I personally don't have leukemia, however, it does run in my family. Leukemia can affect people of all ages and genders. Leukemia mainly is common in children under the age of 15 years old and adults over the age of 55. There are many types of leukemia and they are classified differently. The first type of classification is acute leukemia and chronic leukemia. I will help you better understand by explaining the types of leukemia, the symptoms, and the treatments for this disease. Types of leukemia. According to Mayo Clinic, leukemia is a cancer in the body's blood-forming tissues, including the bone marrow and lymphatic system. The first type of leukemia is acute lymphoid leukemia, also known as ALL. It is the most common type of leukemia found in children. It has a survival rate of 71.7%. Acute myeloid leukemia is also known as AML, and it is the most common type of leukemia known. Has a 29.4% survival rate overall. Chronic lymphoid leukemia, also known as CLL, is most common chronic leukemia found in adults, having a 88.2% survival rate. Chronic myeloid leukemia is CML and mainly affects adults and has a 67.7% survival rate. There are other types of leukemia and they are very rare and it mainly happens in adults. As you can see by the diagram, there are 4 types of leukemia. They are split into chronic leukemia and acute leukemia. So they are divided into different sections. Symptoms of leukemia. Healthline mentions more than 300,000 people are living with leukemia in the United States, according to National Cancer Institute. Leukemia symptoms may vary in the type of leukemia someone has. Someone with leukemia might experience fever or chills, fatigue, unexpected weight loss, swollen lymph nodes, easy nosebleeds, bone pain or tenderness in their body, tiny red spots or rashes in their hands or feet or your chest area. As you can see by the diagram, they do have the different types of symptoms someone may experience, and they do have where the red rashes may occur, and they give out a list of what someone with leukemia might experience, the symptoms. Treatments for leukemia are chemotherapy, which is where you sit and you sit there for a while and you receive a strong medication. Targeted therapy, which is closely related to radiation therapy. However, they are kind of different. Radiation therapy is where you're getting direct radiation from a machine in the hospital. You do have bone marrow transplant, is an injection in the lower back of your body, and you do have the option of clinical trials, depending if you qualify for it. As you can see by the picture shown, that these are the 3 most common types of treatments for this disease. You have chemotherapy, which is where you sit and you take strong medications to try to fight off the disease. You have bone marrow transplant, which is an injection on the lower back near the pelvis area right here. And you have radiation therapy, which is where you lay in a room for short periods of time, depending on the doctor and the amount of radiation you have to receive to fight off the disease. I have explained the different types of leukemia and symptoms along with the treatments. I hope that anyone finds this information helpful and recognizing the various types of symptoms to this disease. Thank you.